Um, Good afternoon, everybody. Thanks for being here. I'm Dan Tsai, your Director of the Department of Public Health. I'm joined here by Dr. Hillary Kunins, who's our Director of Behavioral Health, along with Alyssa and Joelle, who you will hear from shortly. As usual, this is the monthly time when we go through the monthly overdose death numbers that were provided from the Office of the Chief Medical Examiner. So I will jump into that, and I think we have some very powerful stories and testimony for you to hear today. Um, so on the numbers, for the month of July, we had 51 overdose deaths. Uh, that is on a year-to-date basis, meaning between January and July, we're running at about the same number of total overdose deaths as 2024. And I want to highlight, as I do every month when I come up to announce these numbers, that every overdose death we have here in the city of San Francisco is preventable. It is unacceptable, and we won't be satisfied until we have a dramatically different outcome. And what we have been focused on in the city, both here at the Department of Public Health, along with other city departments, is making sure that we can proactively be on the street, be in the community, meet people where they are at, and very quickly connect people to effective treatment and recovery services. We have been rapidly expanding treatment capacity. That's both medication that is evidence based and is proven to be able to help people in treatment and recovery for use of opioids, fentanyl, and other substances. We have residential programs. We have a range of treatment programs that are effective. And for if you are hearing this for yourself or a loved one or a family member or a friend, what I want to make sure we want to make sure folks know is there are treatment services, there are recovery services. Recovery and treatment is possible. We here in the city and the Department of Public Health are here to do everything in our power to make that happen for folks quickly and easily. We've made progress. We continue to have to do more, and we won't be satisfied until we have not only a very different picture of overdose deaths here in San Francisco, but we also have a system of behavioral health care that can rapidly respond and meet people where they are at and help folks live to their fullest potential. And so I'm not going to say much more now because I want you to be able to hear some of the stories of folks with lived experience here. So I'm going to turn it now to Dr. Hillary Kunins, who's the Director of Behavioral Health here at the department. Thank you.
Thank you, Director Tsai. Good afternoon. Today, we are proud and excited to launch the next phase of our campaign, Living Proof. Living Proof features stories of people, real life people in San Francisco with hope, resilience, and long-term recovery. It aims to show folks who use drugs and their loved ones that recovery is possible, and we at DPH are here to support every step of the journey from addiction to sustained recovery and stability. As you heard from Director Tsai, we have highly effective medications to help people recover from opioid use disorder and treatment programs that are available at no or low cost through the department. In Living Proof, we feature and work with San Franciscans who have benefited from addiction treatment and recovery services to tell their real life stories. Our goal is to inspire more people to get into treatment and recovery services. You'll hear shortly from two people, as you heard from Director Tsai, Joelle Yates, Alyssa Ibarra, who are living proof that treatment works and recovery from addiction is possible. Across the city, on billboards, in bus shelters, you will see images of Joelle and Alyssa, as well as 9 other people in recovery. You'll also hear their stories on radio and over social media. We know that role modeling is one of the most effective strategies to support people who might be thinking about or thinking to get into treatment. It's why we launched the Living Proof campaign in 2024 and why we are launching the second phase of the campaign during Overdose Prevention Month. Joelle and Alyssa are beacons for people who have active addiction, reminding them and all of us and their loved ones that help is here and recovery is possible. If you or a loved one are seeking help from opioid use like fentanyl, heroin, or pills, or if you have an alcohol use disorder, you can call 888 246 3333. On the other end of the line will be someone who can connect you to an immediate referral for treatment, including medication for treatment for opioid use disorder. And if you don't come to us, we are working on coming to you. Our nighttime street navigators facilitate telehealth calls every single day until 2 a.m. in the morning. Joelle and Elisa, we really want to extend our thanks for your participation and generosity in this campaign and sharing your journey with all of us. First, you'll hear from Alyssa, who I invite up to the podium, and then we'll turn it over to Joelle.
Hi, my name is Alyssa. My addiction started when I was 22. I fell down the stairs and I broke my ankle, and the doctor prescribed me Percocets and didn't really tell me too much about it. I didn't realize what was happening until she started trying to wean me off. And even then, it wasn't that bad. But after having my daughter, I think the postpartum really kicked in, and that's just it. It started again. I think someone handed me a pill, and I took it. And before, just a few days, it was not recreational anymore. Anyways, my sister encouraged me to get treatment, so she helped me find OVIC in San Francisco, and I have been sober since July 2021. I think that's it.
Thank you, Alyssa.
Thank you so much, Alyssa, for sharing your story. We are deeply appreciative, and so many congratulations for your work and being in recovery. I'd like to now call Joelle up to the podium.
Hello, everyone. My name is Joel Yates, and I'm living proof that recovery is possible. Addiction is a disease, and my disease brought me to a detox center in San Francisco hours before it might have been too late. I grew up in this city, but left as a young man. In college, after experiencing racism in housing and dealing with the loss of scholarship, I started using drugs, and it led me into a cycle that caused me almost to lose my life. I hoped that the usage would give me relief from the pressures of my life, and it was too much for me to hold on my shoulders alone. Eventually, I ended up in an emergency room. My kidneys were failing, and my daughter almost lost her father. It was minutes before it was too late when I walked into that emergency room. In detox, someone handed me a list of programs. I found an intake, and even though I didn't look like somebody ready for change, they welcomed me. I saw the care and concern in the doctor's eyes as she kept me safe in the hospital bed for as long as she could. The hospital staff embraced me. They told me I could do the same for myself. When I left the hospital, I reached out to people for support and found there was still love and support to be found here in San Francisco, the city where I was raised. Strangers gave me advice. They even left food and supplies while I slept on the sidewalk. These people told me just show up, and when I did, they listened. They said, you can come back. You can do what we did, and I believed them, and so I came back. I soon realized recovery starts with a choice. And when I started my recovery journey, I found experiences people shared with me and the hands that reached out. Those were the things that I needed. Those were the things that helped me to make a difference for myself. I've been in recovery for over 8 years now. I tell you, it was those kind of people and all the support that made my recovery possible. That's why I'm part of the Living Proof campaign, to say that I'm living proof is not just a message, it's a tool. My hope is that the tool might change someone's mind and help nudge them down a path towards freedom. Its experiences, its resources, and love. It's something that might help someone at least take an honest step in that direction. I wanted to be a part of this campaign because it's built on the backs of so many people who care. It's a combination of my friends, experts I've met in collaboration, concerned citizens, and above all, it's about love. I'm here because someone out there needs a piece of that, one of those things I just mentioned, just like I did. Thank you. And I was asked if I might share some words. Because I'm in recovery, I'm able to hold on to talents I was blessed with and move forward in artwork to help those like myself. What are you telling yourself? I smell. I haven't looked in the mirror in a long time. I'm a stranger to my family. Unless it makes me feel good, I run away from it. I just want to function when I wake up. I don't want to be afraid anymore. I want to feel good. I feel bad. I can't stop. I don't want to stop. I think I'm going to die like this. Leave me. I'm going to die here. But I tell you, we want you to live. Sidewalks are cold, but it doesn't have to be forever. Your insides are sick and scream relief. Today it can stop. The madness that is familiar and scares you, it can go away. There's a day to smile and you don't have to cry alone. So I ask, how do we call her into life when the cold concrete has wiped the memory of choice from her eye? How do I tell you to love the ones whom you quake at the thought of them coming to your door? What words do we say that someone might live? What prayers to offer up for those whose turn it is to be saved? In which season is it to step up and smile? And at what moment does one dig in the earth and plant a seed? At which point is the miracle? The moment that God is life, the moment that is known and remembered, the moment that we show up and share. Thank you.
Thank you, Alyssa and Joelle, for sharing those very powerful stories, and that recovery is possible, and there's support, there's help for folks that need it. So with that, I think we'll open it for any questions folks have.
I didn't catch that. You said on the same pace for overdose deaths as last year. What's the number so far this year?
412 to date. Last year was 419 over the same time period.
Any other questions? No? Great.
Okay.
All right. Thank you.
Thank you all.